Health and safety at work. Introduction. In this module, you'll take a look at the effects of providing a health-conscious workplace for employees and the positive effects that can have for individuals and the organization. It's absolutely crucial to maintain health and safety in the workplace for legal reasons and to protect the well-being of the workforce. In this module, we'll be taking a look at how this can be achieved by learning about health and wellness programs, health behavior programs, health screening and maintenance programs, mental health programs, evaluate the need, planning process, implementation of plan, creating a culture of wellness, evaluate results. Health and wellness programs. Given that we spend so much of our time at work, it's hardly surprising that our mental and physical health can suffer. There are, however, plenty of ways to prevent this. Companies can support and adopt programs that promote healthy behavior and wellness. Some of these to look at in more depth are health behaviors, health screenings and maintenance, mental health, physical injuries. Health behavior programs. These programs primarily focus on employees' physical health and can be deployed to help with substance abuse problems being suffered in the workplace. This can involve doing more physical activity. This can help people lose weight, feel happier and more energetic, sleep better, and even reduce their risk of certain cancers. Some options for a company to support this could be sponsoring employee sports teams, allowing employees out for a walking break, encouraging staff-wide community walks. Nutrition and weight loss. Poor nutrition can cause mental health troubles that, as well as severely distressing the employees, can lead to decreased productivity. Measures employees can take to encourage better nutrition and weight loss could be providing a vending machine dispensing healthy products, providing free fruit to employees, providing water coolers to encourage hydration. Stopping smoking. Helping employees stop smoking can encourage healthy behavior and the avoidance of all kinds of terrible diseases, including cancer, diabetes and rheumatoid arthritis. A company could offer free nicotine patches or reduce the cost of health insurance for non-smokers as an incentive. Treatment for drug and alcohol addiction. While it is extremely difficult in an office environment to effectively treat or help treat people with substance abuse problems, remember, it is beneficial to your company to support your employees in order to avoid increased healthcare costs, increased employee turnover, reduced morale. Health screenings and maintenance programs. These are invaluable in boosting company-wide awareness and long-term prevention. Helpful company practice can include preventative care screenings. Keeping employees healthy and aware of their bodies should begin with general health assessments, dental health assessments, diabetes testing, BMI testing, cancer screening. Early detection of cancer is key to survival, and screenings are a key part of this. While not all the types of cancer can be detected via screenings, it is important to promote them in the workplace, as well as encouraging employees to visit their physicians. Companies should help employees screen for breast cancer, skin cancer, prostate cancer. Annual examinations. Annual physicals are vital for employee health, general morale, and reduced workforce turnover. Some types are eye tests, general physicals, well child checks, pelvic exams, maintenance programs. Once identified, health issues should be treated and maintained. Companies can encourage this and often focus on cancer, obesity, depression, immunizations. Productivity in the workplace is negatively affected by stress, depression, grieving, and employees in need of a support system. Providing mental health programs can help with these and go a long way to helping the company in the long run. This should be focused on stress management, promoting positive employee interaction through book or sports clubs, and meditation breaks can help. Support groups. An internal support group can help employees cope with anxiety, decompress, and educate themselves on treatment options. Counseling. Professional therapy can really help employees work through their mental health problems and return to the workforce stronger and happier. Awareness and education. There is still a stigma around mental health that organizations have an obligation to stamp out. This can be done through company-wide educational awareness programs. Evaluate the need. It's vital to establish where the company is in its tackling of health concerns in its workforce before any planning can begin. It can begin to do that by reviewing current and previous programs. Before moving ahead with a plan, it's best practice to analyze where the company is and has been, and finding room for improvement. Environmental factors. It's vitally important to evaluate the office space, including the decor and lighting, to make sure it isn't hazardous or stress-inducing. Identify common health conditions and procedures. In order to know which health programs to implement, it's good practice to evaluate the most common diseases and their causes. Health insurance claims should be checked. Review company information pertaining to employee health. Establish if there is a correlation between absenteeism and health concerns, for example flu, using company personnel records. Adjust the program planning according to findings. Planning process. Once enough data relating to the various health and behavior programs available has been collected and collated, planning can begin to deploy these programs across the organization. To do this, there are 4 major steps. Forming a health and wellness team. This will streamline the planning and implementation and should comprise of representatives from legal, human resources, unions, nursing, marketing, senior management, general employees. Define goals. Establish how the goals are meant for, how they can be measured, what the incentives are, and what the success rate might be. Budgeting. Account for these costs. Material. Incentive. Outsources. Advertising. Employee time. Programs and policies. Identify the mandatory policies and the voluntary programs that will comprise your health initiative. Once you've been able to create a coherent plan that will result in organization-wide policy or programs, it's important to implement effectively. There's no use creating a flawless health and behavior program that will cater to the entire workforce if you are unable to implement the plan correctly. Implementation comes in 4 stages. Getting management support. Managers should lead by example. It will help create a wellness culture and foster trust with a shared goal. Test it out. Stagger the launch of the program. This will allow you to see, incrementally, which elements are working. Get the word out. Spread the news of the new programs across the workforce, perhaps using emails, company newsletter, posters, announcements at meetings, incentives. Wellness incentives will drastically increase the uptake of the program. Some incentives might be free screenings, discounted gym memberships, discounted vaccinations, cash incentives. Creating a culture of wellness. A culture of wellness encourages a healthy lifestyle in the workforce, which demonstrably improves a company's performance. To achieve this, try offering access to healthy food and drink. Allow employees to take regular breaks. Maintain alcohol, drug, and smoke-free workplace. Eliminating all potential workplace dangers and hazards. Evaluate results. Once your program is in place, your incentives set up, and your culture of wellness keeping the new order in balance, it's vitally important to maintain everything through evaluation. Do this by checking your results. Find out how many people in the company are participating, check employee insurance claims, and look at absenteeism data to see if the program is working. Employee satisfaction. Make sure the employees who are involved in the program are enjoying it. Ask them what they like about it, and perhaps how it might be improved. Revise plans as necessary. Use the feedback from the workforce to maximize the elements of the plan are working and are well received. Share achievements. Praise and progress often go hand in hand, and if you want the program to continue to be a success, you will need to share the achievements of the group or of the individuals with permission. Summary. In this module, you've learned that establishing health behavior programs is very helpful for company performance and morale. Helping employees stop smoking can truly benefit a company. Companies should help their employees access preventive care screenings including BMI testing and dental appointments. Mental health programs should consist of stress management and, if necessary, counseling. A health program won't be consistently successful without a thorough evaluation of results.